Can you see it okay?
Yeah, we can.
Yeah.
Wow.
All right. The two places I think that have influenced me the most. So there they are.
What's the second one?
University of Florida,
Okay,
where I'm at now.
Right. Okay.
So I trained here, stayed back here last 10 years.
Okay.
Yeah, do infection control, antibiotic stuff, and infectious
great.
disease. I'm going to keep this very short. You've heard this. The only thing I wanted to add to it is you've seen all these multiple ways, right? It can come through direct contact, indirect contact. Honestly, the direct contact stuff is so much lower. I don't clean every single grocery like it's like go crazy with it now, like I used to. The transmission of those things is very low. From newspaper, from things like that is very, very low now. From what we understand, everything that was grown before was all like dead virus. It's more a problem if you're touching like hand knobs and things like that multiple people touch. But otherwise, if you're buying, like you're reading your newspaper that's delivered in the morning, it's no issues. The airborne droplet thing is a lot of debate. I'll just quickly show that the droplet is what happened, that whole 6 feet thing, that you have to stay, if you stay away from someone by 6 feet, you'll avoid the droplet. But if you look at this, they're not uniform drops that form into big drops and droplets and really small in that droplet nuclei. Real world doesn't work like that. It's a mixture when someone coughs. So you have this whole continuous fog or cloud that forms. So that aerosol is important too. This is one that is from our university that kind of shows what happens. You might have seen all variations of this. So it does spread over a distance and continues to spread and stay in the air. So while you see this more and more over the next 2 weeks, and that's why I wanted to bring it up, it's not worrisome when people say airborne. We worry that it's going to come even wherever, right? The name is unfortunate. The only thing that matters is that it is more of a problem indoors and in small space. Like if all of us met in one of our classrooms now and the doors were closed, we would all be at crazy risk. If we all sat in like backfield and we were just sitting and talking just like this, we would be perfectly fine. So this is more where indoors aerosol becomes a major problem. And it can be even with someone speaking, with someone laughing, singing, or it can be with laughing itself. And you can have a lot more people get affected. This is what happens with the super spreader event, that a lot of people get exposed at one time. It's usually all indoors. And it's when this aerosol becomes more of a problem. Everyone feels well, they're all celebrating. I've personally seen this happen in so many issues. So this is the one thing to watch out. Don't go to that one function that you can avoid that is 20 people in there. They'll say they're separating it out by 6 feet and the chairs are pulled apart. But once you get there, you have some food, you have maybe a drink, no one's 6 feet apart. And even if you are and it's indoors, it's a problem. So stay outdoors. I go to the beach here, it's fine. You guys go on KBR Park. If you're going, you're more than fine. It's only a problem if you're indoors. It really is truly a problem only if you're indoors. And at work, and you have to see how to separate that at your work or for your own employees. This is something we
Karthik, can I interrupt? Karthik?
Yes.
Karthik, a small query. You're saying something what? We want to stay indoors or outdoors? Which one is safe?
Outdoors. Outdoors is so much safer. So we have got the messaging wrong. We are essentially telling people, be careful, don't go out, stay safe, stay indoors. That message has been sort of come across in the wrong way. Yes, it's good to be socially distanced or physically distanced from people and not having too much exposure is good. But indoors is not good. Indoors is a problem. Outdoors is no problem. I would gladly meet you guys all, like I was saying. We could have this in backfield and we would all be fine.
Oh, okay.
We would just be sitting a few feet apart. We would be more than fine as long as we didn't do a lot of hugging and or start getting drunk and do things. We would be more than fine if we were outdoors. I think that's the thing that's been missing is everyone talking about stay at home, stay at home, stay at home. It's become that we don't want to go outdoors, and if you want to relax, we'll have 2 or 3 of our friends over. That's where the problem is.
Okay.
It's okay to have your friends over if your friend circle is small. If you can control that friend circle, like I stay in touch with my neighbors and a couple of my friends. Like Shripal came over this morning. You guys remember Shripal? I don't know why he's not logged in. He lives 3 houses away from me. Um, P section, greens, um, blues.
Greece.
Um,
Sripal Aditya.
yes, Shripal Aditya. So he lives 3
Here's,
homes from me.
here's Takshila.
Yep. Oh, yes. I keep mixing up. When I look at him, I can remember that whether it was green or blue.
We had watched
So,
a match together at the Lal Bahadur Stadium.
oh,
This
nice.
was India New Zealand, where Tendulkar got his 186, if not wrong.
Oh, wow. Quite the match to watch, huh?
Yeah, lucky there.
Oh shit. That was basically a
And so sorry to button in the presentation, but
no, please. There's no thing.
this
Yeah,
was
yeah.
the,
Okay,
the
Karthik, please go ahead. Yeah.
quintessential free pass of Lal Bahadur Stadium. So go on.
Oh,
Yeah.
oh, I didn't know that, man. Why didn't we use that before? Uh, Last time I came, they grabbed my camera, didn't let me go in. I had to plead with people to keep my camera and then go in. We watched the T20. So really, honestly, outdoors is much, much safer than people make it out to be. Don't be in a 500 people gathering outdoors, then it gets problematic. But if you're meeting 5-10 of your friends outdoors completely, and follow some basic things, it's very safe. Indoors is not. So if you get too precautionary, right, what happens is, man, you can't breathe at work, you can't meet anyone else. It breaks down, like where things break down is at work at lunch. Suddenly everyone's masked off, everyone's sitting in a room and they're all eating lunch together. That's where most of our exposures happen. At work is at lunchtime, and at home it's small events. Honestly, people who live in with small bubbles, like Madhu only meets um, say Vasu and 2 other people, and that's all it is. It's not an issue at all. That's not where the problem is. The problem is, um, most people I'm dealing with in India tend to be either uh, exposure to work, help at home, because they work in maybe 8 homes or 9 homes and they're working inside your home. That's been the biggest exposure I've seen. They take every sort of precaution, but the person who comes and washes their dishes is a big exposure for them.
Which means the
Not to
servant is
say other things.
servant is a danger. Servant is a danger.
Anyone is a danger. I don't want to make it seem like servant is the only danger. Anyone who doesn't follow. If you have a 13-year-old child who will go meet with 20 of his friends, yes, your son is your danger.
Oh.
Anyone who has a lot more exposure than you and meets inside your home or lives inside your home is the problem.
Okay.
So what we've shown here, this is from our work at the university. We've been able to culture the virus from the air. This just happened like a few days ago. So you'll see this more and more in the news, and it will cause people to get worried that it's going to spread in the air. It won't spread across a basketball court, right? If you're playing basketball in our court at school, it won't spread across there. There's no way, because it dilutes in the air. Even in 3 feet, it won't come there. But you'll see this come in the news more and more, that it's airborne. It's not scary. The same rules apply, basically. That this now finally explains why so much spread happens in one event. Why 700 people can get exposed in one event is because it's airborne indoors. This is our way we checked. We put one inlet section and another one a room away in a connected room. It could be grown 12 feet away. So that 6 feet rule indoors doesn't really work well. And this is in our hospital room, which is one of the best air circulations, 6 air changes per hour. The returning air is all UV lighted. Anything you can think of, it's done. And still you can collect it 10, 12 feet away. So basically indoors, the only thing that really protects you is with everyone wearing a mask, or if that's not possible, a shield. So if you're indoors, that's the only thing that will protect you, not your distance. You can be sitting in a board room meeting and 6 feet apart, and you're still at risk. If you remove your mask, thinking you're wide apart. If nothing else, that's the only thing I want to get across is the distance doesn't apply well indoors. Outdoors, you can even be 3-4 feet apart and you're fine. So that 6 feet magical number is not really an accurate one. This is us growing the virus on the cells, and it clearly showing that it was the same virus from the patient and what we grew in there. So we have these tools. We don't control screening, testing, contact tracing. That is beyond our control. The rest of them we can do. The most useful one is outdoors. The other ones is the face mask. And then hand sanitizer is great because if you touch a knob and touch your face, that's the only problem. Otherwise, it really is not as much of a concern. Wearing it well is good, and only the right way. This is a problem everywhere. You'd see people, even those who wear a mask, don't have it on their nose. So it exits out from the nose and mouth, enters through eyes, nose, and mouth. So exiting, you cover nose and mouth. If you have to protect yourself, you have to cover eyes, nose, and mouth, all three. So this ladies who were positive in a hair salon here were wearing masks and had exposure to 139 people. None of them got infected. If the person who has maybe the disease wears a mask, it doesn't matter if you're this close to them, even within inches, right? If you're cutting their hair, no one else got the infection. That's really how powerful it is. So these just numbers showing that the risk drops significantly when someone wears a mask. And this is tough, but if you're at high risk, or if you have someone who are at higher risk, wearing both, say if you're going to a small event that you can't avoid at all because it's extremely important, right? Your parent or grandparent wants to see your child or something. If you wear mask and wear a shield over the eyes or goggles, that's probably the most protection you can take. If you wear both of them, it's tough to do it all day, but if it's a small thing to do, I wear it all day. Now I'm used to it. But if you're going for something that's 30 minutes, 1 hour, wearing both, it sounds crazy, and socially people will be like, what the hell are you doing? Maybe, but it probably offers you the most protection.
Karthik, again to interrupt you, you're saying somewhat like eye protection. Through eyes also
Yes.
will it be infecting, or it'll be entering
Yes.
into the body, or
So
how is
they
it?
can cause infection in the eye through the eyes, nose, and mouth.
Conjunctivitis, eye infection sort of a thing, or
Yeah, almost all viruses, but this one definitely can enter through the eyes too.
oh.
So these are close contact stuff, and but sharing that if you're drinking together or if you're spending time together, the utensils thing is sometimes forgotten if you're sharing food. And really you need relatively high enough time of exposure. You need about 15 minutes of exposure to a person to really get it. So if you pass someone in the hallway and found out they were positive the next day, really doesn't get across that well. This is not as infectious as say measles is. It takes quite some time of exposure, and that's why indoors and with your family member or with a friend, spending substantial time is when you get it, not when you pass someone down the road or you're walking by in KBR and someone walks across you. You're not getting infected there. You need substantial time for that. So most panic I see is because someone in your apartment complex somewhere or your next door neighbor had it, you didn't even have contact with them, and you go crazy about how worried you should get. That really doesn't infect you. It takes at least 15 minutes and the circumstances all to be right to get infected. So I'm going to
actually
go
very
through this quickly. You need both things
so,
to wear.
so just
Yes,
one
sure.
something, Karthik, very interesting is that so so what happened here in my apartments, I think we went into lockdown somewhere around March 15th, and around 28th or 29th was the first positive case in our apartment, and it was all pandemonium because then our our entire apartment was sealed for about 7 days. And this was somewhere, I think someone on the 10th or 11th floor, and we were like on the 21st floor, we were like, it's it's like crazy. So lifts were shut off and all of that. It became actually very, very crazy, and we were just literally I think house locked for about 7 days, and it was really madness. Now I think it's slightly better now because we've had about, I think, 12-15 cases just in our apartment, but then it's not got that bad. But initially, yeah, I agree with you. I mean, it was like crazy. Like
Yeah,
everyone would get it and all, even though there was no no history of anyone connecting with that person.
Yeah, and that happens, right? It happens all over the world. I know in Bombay, one of my friend's parents, they wouldn't let them even use the garbage disposal if they had it. There's a lot of things there. It really doesn't communicate well there. If you have to protect yourself, again, I repeat, that's your only exposure. That's a problem. Is the indoors prolonged period that's 15 minutes or longer, and you're within that in that indoor space. That's the only area it spreads. If we all met, say, in one of our homes now, and one of us was infected and asymptomatic, you would have enough people affected. That's the only area to say. Now, the worry is that it can be anywhere, in any way you can get it. Man, we are only human. After a few weeks, months, we can't take every precaution all the time, right? But the easier thing is if you avoid that indoors and the gathering, everything else is fine.
Hey,
It doesn't
Karthik.
really spread as much with anything else.
Yeah, Karthik.
Okay, speed up. Yes, Ranjit.
Ranjit here.
Yeah, yeah.
So the asymptomatic cases where we see actually, I mean, we really don't know they don't have. We too don't know whether we have or we don't have. So how do we actually know something, or how do we take care?
So that's where the problem is. And this is a busy slide, but that's really what I wanted to show. Ignore all the lines, right? The top, it's before symptom onset, after symptom onset. There's this big line, right? 2 days before symptom onset, you're actually very, very infectious. That's reflected by these big curves in blue and pink, and the red one. The red one is the key one to look at. It goes up really high, especially in that 2 days prior to you having symptoms, and about 3 or 4 days after you have symptoms. And then it falls off very rapidly. Even 5-6 days later, you don't really get it. And the safe time is about 7 days, maybe, or 10 days. But the maximum exposure is that 2 days before and even 3-4 days after. That's the only period. After that, you're really not infective. The people who we worry about who've been positive and living in our apartment complex, they've been positive for a while. They're your safest people. You'd rather go sit next to them and have food. They're not your problem. It could be a problem if there are other people around them in their own home are in the early stage, yes. But that particular person, I would gladly walk in their room with wearing nothing at all after 10-15 days of their positive test. They're the safest people that you have around. The people that you don't know is either Shravan or I could be infected right now. You look perfectly fine, especially you're young and healthy. You have nothing that you'll know until 2 days later. That's where it's a problem. So in some ways, you assume people are infected, and that's why I avoid the indoor gathering. Because if you have 50 people, very high chance one or two of them has it. So as you increase the number, the chance that one of them is asymptomatic and shedding increases substantially. So you keep the gathering small, keep it to within people you know, and people you know will follow similar things to you. So you can have your kids play, you can have your spouses meet with their friends, with your friends, you can meet theirs, as long as you keep that number relatively small. If one or two of them don't really follow like you do and they meet 20 other people, then it's pointless. So if you have a pact with 3 or 4 families where you're all good, you know them very well, everyone follows it, you can have good social interactions. And we all need that. The problem is if one person from that group is not really following it, meets with 50 other people, then it's gone. So think about that, about having that social bubbles that they call. If you have very careful, good people who can be very careful, that's where you can let off steam, you can have good social interactions and not put yourself at risk.
Out of worry
Being
of
careful
touching.
for the whole month and then deciding I'm going to go to this one event or one dinner messes it up.
Yeah. Out of worry, we are not going out to play. In worry of touching the common areas, let's assume that there's a ball that we're playing, and the ball goes around the place, and again touching it. You don't know. It's all a worry just in our heads. We come and sanitize that. We sanitize our hands. I mean, it's terrible even to think about playing outside these days. I mean,
it's very low. If you're playing tennis, if you're playing cricket with 3 or 4 people, it's very low.
no, that's with the kids. I'm saying stop
Yeah,
playing with others, but with the kids around, we go out to play in the play area.
Yeah. If you keep the kids' number low, that they're interacting with, like my one there,
Yep.
you can still do it. If
Yeah,
you're having
yeah.
them 2 or 3 and the same 2-3 kids play, then it's fine. If you change the kids around every day, right, they play with 15 other people, then it's a problem.
Okay.
Because as much as they're saying kids don't transmit, they do.
Okay.
It's lower for younger kids, but they do. All right, before I scare you guys too much and take up too much time, I'll just run through this quickly. But feel free to call me with things or email or message me on WhatsApp if things come up for you. I think Vasu is going to talk about some of these and symptoms. They're actually very mild. Most common are headache, sore throat, and things like that. Fever is very uncommon. So if you're waiting for fever and just doing fever checks, you're going to miss it. Headache, sore throat by far is the most common one, and some fatigue. Everything else is much lower. So this is chart that's there up on the CDC site. I think it's good. Look at all 4 scenarios. You have contact with someone, that 14 days, you have to be out after the last contact with someone who's positive. If you're having close contact, but at least one of you can isolate in a room and things like that, then that's still fine. If you can't isolate yourself, it's your spouse who's positive, your kid who's positive, then you go a little bit later. Or that other person has more contact with someone else. This last one is where you have to look at the last possible person and their time to be clear from infection, which is 10 days after they got infected. And then if they're living in your home, it adds another 14 days. But these are good enough things. I'll pass it on a PDF. I don't want to take more time. The most important one is, if you know you had exposure, don't panic. Pause. 2 days, nothing is going to happen if you got exposed today. You're not going to infect your family, your spouse, anyone else in that same day or 2. Most people panic there, either rush like crazy to the hospital or do all sorts of crazy things that will put you more at risk. Those 1-2 days, nothing's going to happen. It's a different scenario if you found out you were exposed 5 days ago. But if you know that you got exposed today or yesterday to someone, don't panic. It takes at least 2 to 3 days, if not 4 or 5 days, for you to be positive or even transmit to someone else. So don't panic if you have it, if you've had an exposure within those 2 days. This is where some things are low risk to higher risk, and the same things apply. Is it an enclosed space? How much time are you interacting? Can you keep your interaction to a smaller time? If you're going shopping, can you do it quickly? Come out? Yes, 5 minutes is not a risk at all. Can you avoid crowds? And can you avoid places where someone is singing, yelling? So if Srivatsa was singing today, please don't go attend his concert in his home. So that's where I think we've got some of the messaging wrong. Some things are safe. If you're going jogging, extremely safe. You're going along jogging in Bombay by the coast, it is safe. If you're going to the beach there, unless it's crowded. If you're going at 5 in the morning or 6 in the morning, no one is there, it's very safe. It's much safer than being indoors and meeting people. So in the beach that I go to, they're about 10-15 feet apart, and it's very safe. If they start to get closer to me, I move a little bit far. If it's getting too crowded, I leave. But outdoors is very safe if you can maintain some distance. The things that we think are safe, if you're going to a gym, those tend to be a high risk situation. We don't think of it. They talk about how good the facilities are. They clean everything. It's amazing. No, it's not. So playing sports is very safe. Shopping is safe because you don't take that much time. Outdoor picnics and things like that are safe. Running, biking and stuff are safe. It's when you start getting indoors and more crowded, that's when it becomes a problem. Takeout is fine. Delivery is fine. The whole pizza delivery, that's completely fine, despite whatever our CM says. You can have your pizza fine. Don't go into a restaurant to have things. A lot of things don't work anymore for treatments. They're all going away. The problem I face is the calls I get is you get on telemedicine with with some of these doctors with chest medicine or with someone, and they prescribe 20 medications for you if you're exposed or if you're positive. It's crazy. Please don't follow those things. I was one of the investigators in the trial which showed remdesivir actually works. I've participated in at least 6 COVID trials now, and this is my work, is developing the therapeutics document for the university and for state of Karnataka. I'm one of their advisors for state of Karnataka. I'm also the advisor for the Bangladesh government. I can tell you I've read more about treatments than probably any other person
Great.
that you would know.
Wonderful.
Wow.
I would say
Karthik,
if someone
before
prescribes you
Karthik,
steroids, don't take it. Yes.
yeah, Karthik, I have got one small information which I want each and every one of you to listen. This incident has happened to me. I'll tell you, Karthik, I really got scared in the month of March, which was prior to the Ban, which was, like when COVID has entered India. I had been to High Tech City on 18th and then evening hours. And on 18th night, when I was sleeping, I was unable to breathe properly. That really scared me a lot. It went on for 2 days where, the breathing stuff and all, it took a lot of time for me, like I used to press my tummy and, I should take a lot of a deep breath only. Then that uneasiness came and I was a bit scared like that. And what happened was I called up Hira Singh, I called up Vasu, everybody was asking about the other symptoms. But breathlessness that has taken to me also. So after that, I spoke with Mr. Our chemistry teacher who actually need to come over today, Mr. Vaivya Krishna Rao. He said that this COVID-19 is a thing which will be automatically, which comes into the body, it stays in the body. Whenever there is a fever or a cold or something, it bursts open. Now, do you think the symptom of mine, which I told, is inside my body?
As in, are you asking what the virus was inside the body when you had
Yes.
symptoms?
Yes.
If you were positive, it's quite possible. But we forget that even before this happened, right? So many
Yes.
things would cause similar symptoms. Many viruses cause very similar symptoms.
No, actually, we have to explain. Yeah.
I mean, if you're positive, yes. And Vasu has a very good slide on it to show
Oh,
where
I
it
see.
infects the blood vessels and where it
Mhm.
infects the lungs. It's a problem of the blood vessels as much as it's a problem of the lungs and other places.
Mhm.
So I I would let him speak on it.
Hey,
Don't
Karthik,
get a lot of CT scans. This is something I see get because you don't have access to tests. There might be circumstances you'll need it, but I've seen people get now 6 or 7 scans. That's too much, especially if you're no risk factors. I think that's too much to get. I'd rather just quarantine at home. The problem happens if you have a loved one who is more risk and you want to know whether you're positive because are you infecting them and so on.
Mhm.
So I understand it. Like I was trying to help someone in Karimnagar. Nowhere do they have a test that they can do for COVID. So what are you going to do? So in some circumstances, I guess so, but there's a lot being done, and they come with their own problems. I know one person who had 5 CT scans in 6 days. It causes other problems. Just be careful with that. There's a lot of medications that are pushed, and it's controversial, but I can tell you, if I had it, my spouse had it, my dad had it, I would not give them any of these medications.
hey,
None of them.
just want to check one thing, Karthik. See, I'm very interested in the second point, what you've mentioned here. Do not use zinc and then erythromycin. If I were to look at that, at least in Hyderabad, I know a few friends and, a few folks, even if you look at these guys who are these chemists or even doctors, a lot of them are pushing zinc, use of zinc and like Zincovite and all of that and erythromycin. Why would you say not to use that?
Because if you look at the virological studies, the amount that is required is probably 1,000 tablets a day. The equivalent that would kill the virus in the Petri dish cannot be achieved in the human body at a good level. I've used hydroxychloroquine, azithromycin back in March when we didn't have evidence. There are now 7 randomized trials which show it doesn't work. At some point, you should say, okay, it doesn't work. It really doesn't. I was hoping it would work, it would have been great. I really want an oral pill that you can use. That would be great. If you're using zinc for a short period, it's not crazy. It's not toxic. A lot of us vitamins will have it. Some of the iron pills will have it. It's not toxic. Where I would be careful about is giving a lot to your kids. I see prescriptions, right? When someone is exposed, the doc treats the whole family. The whole family, the 3 families are managed that all got all of these. So not one. They were taking all of them every day, including their 10-year-old. So be careful. If you're using just zinc, have no issues, go ahead. Vitamin C, vitamin D, it's fine. Go ahead, use it for prevention, use it for taking. Low amounts of zinc is fine. It's when people start pushing it up, saying more is better, and give it to smaller kids and so on, we don't know what it does. So be careful. Maybe I should take out the zinc part and say it's up to you. The others just don't work. And steroid prednisone can be harmful if given to someone who is not on oxygen or not hospitalized. It can be harmful. So some of these come with that effect. If you look at using ivermectin, hydroxychloroquine, azithromycin, all increase the interval and the heart rhythm. So they can cause problems with people. They're relatively safe drugs when you use them alone. Ivermectin is used a lot for deworming. Hydroxychloroquine is used in a lot of people, even for malaria. Azithromycin is used like candy for many things. All of us take it for sore throat or whatever, right? But individually, they're not a problem. They're a problem if you start combining them, and combining them when you have the disease that's affecting your body in other ways. Aspirin doesn't help with the clots that this causes. It just doesn't help. It works through a totally different pathway. It doesn't. So it might actually make you bleed in some areas. So there are other problems. I can't go into this. It'll take 2 hours. And I don't want to take 2 hours. But honestly, the panic makes us take it because we think about what if I can't. So at home, maybe this oral therapy can work. There's not as much evidence to say it doesn't work. If it's a very high risk factor person, they're old, they have heart disease, they have other things, you have access to plasma donation, they're starting to slowly get worse now, that's reasonable. It attacks the virus, you can get convalescent plasma, that's reasonable. Should Shravan or I get it if you get mildly ill? Probably not. In arranging it is going to be very tough too. If you're hospitalized, yes. If I was hospitalized, I would look at getting it. I'll come to the next slide. And pulse oximeter is probably your most helpful one if you're going to stay at home, and most of you have it. The thermometer is not as helpful because it really doesn't correlate well at all. So if your kid has 102 fever, don't panic. Don't drive like crazy to the next hospital thinking they'll die. I know of at least one accident that's happened in that situation. So if any of you have something like that, don't panic. Kids do uniformly extremely well. The one exception you will see in the news is because it's an exception and it's in the news, right? Don't panic there. It's okay to get them care if they're not feeling well. They're drinking and eating fine and they have a low fever. Don't panic. Get some help, but don't drive like crazy and thinking they're going to die now. If in the hospital, we know remdesivir and dexamethasone can be helpful, especially if someone's on the oxygen. If they're not on it, then it's very debatable. Dexamethasone can also cause harm. If unfortunately someone gets on the ventilator, dexamethasone is helpful. The Actemra doesn't really help. Plasma doesn't really help if they're already on a ventilator or into 15 days of their illness. It really works very early within the 7 days only. Doesn't really work much further out. I know people who've contacted everyone trying to get things on the black market, say for Actemra, forget it. If you know someone who has it and is willing to spend lakhs of rupees on it. I've been part of 2 trials that looked at it. I was very hopeful. I've used it in 20 patients. It is not shown to be helpful at all. And recovery can take long. Be patient. If someone you know is older and sicker, don't just say they've not recovered in 10 days or maybe we move them to somewhere else or get them home. They can take up to 2 to 3 weeks to recover. All right, sorry, I was supposed to do 10 minutes. It went long.
No, it's okay. Go ahead.
But that's all I have.
Mhm.
That's my comedy slide. Nothing to do with it. So if questions or Vasu wants to take over, I'm done.
I'm done from my end. Vasu?
Sorry, I see these patients
think
so many
my
times and
slide.
get calls from everywhere, from Russia to India to everywhere. So it was more passionate about speaking about it. Sorry. Go ahead.
Good, thanks.
Is my PPT visible to you?
Yeah, visible.
Hello? Hello, is it visible?
Yeah, it is. It is.
Okay, okay. Actually, I think for me, no need of telling the basics, all this. I'll just go to the pathophysiology. Actually, regarding this COVID, where it started in China, it spreads mainly by respiratory droplets and also during the close contact. So, the first system it gets infected is respiratory tract. That is the lung gets infected, and when the patient it rapidly progresses to severe and critical cases with respiratory distress syndrome. There is coagulation dysfunction and multiple organ failure. So when the patient's immunity is decreased, so patient will land up into this state. So we have to do early identification of the severity. So if we are able to diagnose the patient at early stage, we can go for home treatment or home quarantine. So how it transmitted? It transmitted through bats, then to humans, and how it has spread. How this COVID has spread means where the population or where there is too much of gathering was there. So in these conditions, it helped in spreading of the COVID. So in this is the pathogenesis. So when this virus enters, so mainly the alveoli. This is the initial part. Is this slide visible, Madhu?
Yes, it is visible. Continue,
Okay.
Vasu.
The pathogenesis stage. So in the early stage, the alveoli are infected, and when the patient is progressive, means when the disease is being progressed, so all the rest of the alveoli and the lung cells, everything are infected. So they start becoming edematous. So it will be difficult for the patient to take his respiration. So that time there will be a distress and patient lands up in respiratory distress. So when the alveolar cells they become edematous, when they are swollen, so patient experiences the respiratory distress or difficulty in breathing. And if the patients are suffering with respiratory disorders like asthma, bronchitis, any any occupational disorders, those patients will be severely affected. And also who are passive smokers, especially means the laborers who work in this cement industry, coal industries, or cotton industries. Especially if we can see this type of scenario in industrial areas where they are working in paint industries, acid industries, where they are working with chemicals. In these patients, if these people are affected, they will land up in this scenario. So who is at risk? Everyone are at risk when the COVID patient comes in and around any person. So everyone are at risk. So that is the reason why in India that time lockdown was started and was implemented very strictly to avoid this community transmission. But now we are in the stage of community transmission also, because now contact tracing is not being implemented. I think contact tracing was implemented only till the month of May second week or third week. After that, contact tracing is now not being implemented. So who all are positive, who all are having these symptoms, they have been classified into mild, moderate, severe, and accordingly they have been treated. So what are all the risk factors? Means age is more than 60 years, and with comorbidities such as coronary artery disease, means who have myocardial ischemia or chest pain, who had underwent angioplasty, bypass surgeries, and severe patients who are with stroke, paralysis, or heart failure patients, and COPD. This is the respiratory disorder. So these patients are more susceptible. So most of the Indian population, they are resident of in slums. So where there is no cross ventilation and too much what do you call thickly populated. So in those slums, this COVID spreads more faster than in open air. And poorly controlled bronchial asthma, uncontrolled diabetes. If patients who are suffering with diabetes and longer duration of diabetes and whose HbA1c and their random or postprandial sugar levels are very high, those patients are more susceptible for COVID. And with systemic hypertension, who are on chemotherapy, that is anti-cancer drugs, chronic kidney disease, especially dialysis patients who are undergoing dialysis. These patients are mostly susceptible for COVID because in the dialysis unit, it is a closed unit. So there won't be much social distancing between each patient or each bed. For every within less than 3 feet only, you'll be having one or the other dialysis patient. So spreading of this COVID in these patients is more, and who has undergone transplantation in these 6 months, currently on immunosuppressive therapy, and patients who are with moderate obesity. I think Karthik has told you how the disease spread. It is mainly by droplets, but in Indian scenario, because of this thickly populated country, and I think you might have seen most of the people when the during the lockdown, when they had given 2 hours time or 3 hours time to purchase the groceries, there was too much of crowding. So that was the main reason for the spreading of COVID in especially in Hyderabad, especially in main cities like Hyderabad and all the district headquarters. In rural areas, in the month of March, April, May, the spreading was very less. But now, as the patients who were in this district headquarters or in capital cities, they have moved to the rural areas. Now, in rural areas also, this coronavirus has a good impact. So what is the incubation period? Mean incubation period was 5.1 days. So it starts from second day till the 14th day, but the infectivity means the infection starts from the second day onwards. So 81% of the patients develop mild to moderate disease, which are having the uncomplicated course. 14% develop severe disease, where they require hospitalization. In this 14% only, the patients with this respiratory disorders, cardiac disorders, and endocrine, that is diabetes, and also this patients who are with stroke, all these patients come in this 14%. But among these, 5% require admission in ICU. But in Indian scenario, most of the patients first who are having moderate symptoms, they're being admitted in ICU. So that is the main, ICU is one of the main source for their to get their symptoms or the clinical features being more aggravated. So when the patient was at his home, he has mild symptoms. When he had gone to the hospital, there he had developed aggravation of his
Hi.
clinical features.
Thank you.
What are the symptoms? So it's classified into mild, moderate, and severe illness. And among severe illness,
That is
patient will
nice to
have
hear, but then you don't get to hear any calls.
severe pneumonia, acute respiratory distress syndrome, sepsis, septic shock, multi-organ failure, vasculopathy, hypercoagulopathy, and ventilation perfusion mismatch. So when the patient is on ventilator, if the ventilators are not sterile, if they are not sterile, if they are, especially in Hyderabad, some of the hospitals, because due to patient overload, they are immediately shifted. When the patient has recovered and means has decreased symptoms from the ICU, they're shifting to the wards. So those ventilators and those tubings are not properly sterilized. So when these are connected to the new patients, the new patients are they're developing the aggravated symptoms. That is the main reason why the patients who are being admitted in ICUs are having more duration of stay in ICU than in the ward. So what are the clinical manifestations? Fever, sore throat, fatigue, shortness of breath, malaise, diarrhea, cough, nasal congestion, myalgia, expectoration, especially anosmia. Nowadays, now most of the patients are experiencing this clinical feature. They're having loss of sense of smell. So now first they come with they come to the doctors that now we have lost the sense of smell since 2 to 3 days. So when they are coming with this symptom, because already they might have been exposed, it is 1 week back. So most of the doctors now they are prescribing HRCT, high resolution computer the CT scan. So in that they are being means in that we are able to diagnose some patchy areas or ground glass appearance areas or opacity areas. So those may be recent or from a longer duration. We don't know when the patient was exposed to this coronavirus. So there's altered taste or taste loss, and especially older patients and that is elderly patients and in immunocompromised patients, patient may not have fever, but they may have. These are the more what you call scary. Like they are reduced alertness, reduced mobility because they are lying down in the bed or they are immobile. Why means they tell that I'm little bit of experiencing weakness symptoms. So we think that there is general weakness, but the patient might have already had, he might have come in contact with the corona patients. Anorexia, diarrhea, delirium. And children, now at present scenario, children are not having fever and cough, but when they have been advised or when they have been prescribed for any lung X-ray or chest X-ray or CT scan, in those X-rays we have noticed the ground glass appearance of these lungs. So how come the children are being now diagnosed as COVID? Because after the lockdown in the month of May, these children have come out and they're playing with in apartments or in this, what do you call this? Uh,
Okay, open area.
Not only open area in this. Means because the children, they were in lockdown in the home. So when they have come out, they have been exposed to their more number of children. In gated communities, once only all the children are coming and playing in the garden and everything. So in that stage, so the transmission might have taken a long back, but these children are experiencing the diseases nowadays. So what are the mild illness? What are the clinical features? Means fever, cough, sore throat, nasal congestion, headache, malaise, and they may present with atypical symptoms, that is altered taste, smell, and diarrhea. And in the month of March to May, that is during the period of summer, patients had severe dehydration. But now due to the temperatures have come down, so patients are not experiencing this dehydration. So in moderate, they have mild pneumonia and also same clinical features like fever, cough, dyspnea, and they have breathlessness because the respiratory rate has increased more than 24. And when it is scary for the children, small children, means when they are having this breathlessness more than 60 or 50 according to their age. And in severe, especially in adults with fever, cough, and respiratory distress, especially in diabetic patients, in respiratory disorders, and especially in patients who are with smokers, and also who are working in this textile industry, means who have this cloth stores or what do you call like any blankets, like especially in this Maharashtra borders, especially you can come across the Sholapur. Sholapur, Kolhapur, Sangli, Meerut, Bijapur. These areas, most of these cotton industries are there. So this, and even in Pune. So this was the one of the reason why there are many cases of COVID cases in these areas. And in children, they have respiratory distress, and especially the children of less than 1 year who are on breastfeeding, they come across with a difficulty in drinking the breastfeed. They have grunting and chest indrawing. And in younger children less than 2 months, these are the respiratory symptoms where there is increased respiratory rate. So when do we call as acute respiratory distress syndrome? When there are bilateral infiltrates. I'll show you the radiograph. Means the chest X-ray comes like this. In these areas, you can see some type of opacities, patchy areas. With these we diagnose that there is some pathology. When there is some diagnosis with the X-ray, we go for CT scan. So in CT scan, we come across all these opacities. These ground glass areas. So that time we order for then we suspect this patient has COVID, and we inquire, we take the complete history, then we subject for mild, moderate, severe. So what are the extra
one question here?
Yeah.
Hey, so typically, is there any particular type of CT scan that you asked for?
We ask HRCT, high resolution CT scan.
Okay. Achha, is this known as HRCT?
Yeah. And these are the extrapulmonary manifestations with COVID. Some of them may experience neurological disorders, especially mainly they come across headache, dizziness, and myalgia, anosmia. And if they are cardiac patients, they land up in deep vein thrombosis, emboli, and myocardial injury. And in the endocrine, they are diabetic patients, or they have increased shoot up levels of their sugar levels. And in dermatology, they have skin manifestation. They have small petechiae and urticaria, skin rash like clinical features. And gastrointestinal, they experience diarrhea. Most of them experience diarrhea and abdominal pain, and they have elevated liver enzymes. And in kidneys, especially patients who are in acute kidney injury or in dialysis patients, they experience proteinuria and hematuria. And what are the investigations mainly we ask is, mainly we go for all the complete hemogram, then biochemical investigations, like we go for liver enzymes, left liver function test, we go for troponins, and for main biomarkers, we go for D-dimer test. Now we are concentrating on these three: D-dimer, C-reactive protein, and serum ferritin. In these COVID patients, D-dimer level is very much elevated, C-reactive protein is elevated, and serum ferritin is elevated. So on these three, in Indian scenario, mainly on nowadays in Karnataka, we are concentrating on these three investigations. So how do we collect the swab? Means we collect the swab from nasopharynx, and these are the exam. This is how the clinical scenario represents with the chest X-ray. With HRCT, this is the high resolution CT scan. So what are the rules for personal hygiene? So you have to do hand wash, especially with soap and water. At least the soap should be on your hand at least for more than 40 seconds. Alcohol-based sanitizers and good respiratory hygiene. So better to wear a better mask. So nowadays all N95 masks are available. In the month of March and April, N95 masks were shortage in India. Now most of the companies, most of the manufacturers, they have started manufacturing the N95, and frequent cleaning and disinfection. And especially in the during the lockdown period, there was transmission through these groceries and vegetables, especially in where there was highly crowded, especially in Monda market, those areas. And because at a time, most of the public used to come for purchasing these vegetables, and there was some people who were infected, they had grudge, so they started spreading the infection like that. and also some of the teachers and some of the police people, police, how they have come in contact is who the police who are harassing these what do you call rowdy sheeters, all those what do you call notorious people. They were the main source of spreading the COVID virus to the police. So these are the techniques of hand washing and how to sanitize. So better to protect yourself instead of landing into the disease. So what are the
So,
instructions? Yeah,
also I have a question. You just now said that the cops have got virus through the goons,
yeah,
from the goons or from the
yeah.
patients or from the air.
Means these goons, what they used to do is
Uh-huh.
they used to means already they were the COVID positive patients.
Uh-huh.
So what they used to do is they used to apply those virus particles to the currency notes.
Oh.
Especially this type of transmission had taken place in SR Nagar and near to that Amirpet area. In that area,
Acha.
nearly around 40 to 50 police people, policemen means all the duty who were on the duty, they were infected. So when they were admitted and they were asked how did they come across this? None of them have revealed that they had taken bribes, because during those lockdown, when these police people have imposed fines to them, so that time they used to transmit these diseases. And also in I think in the month of March or April, it was circulated in Facebook. Some of the means teachers, students who are means the teachers who are beating these students, especially in old city,
Mm.
those students, because I don't want to comment about these people. They have got they have acquired this or they have got this COVID, and they started spreading, because only one of the community was targeted in the month of March and April. That was the reason. So patients, they must stay in an identified room. They must be away from people in the home. Means instructions for these patients who have got these symptoms. And hand washing is must, and they have to use clean soap or alcohol based sanitizers. Nowadays the sanitizers which are in the market in India, most of them are fake sanitizers. So it is better to buy the branded one or use alcohol. I think no, no, nowadays this we are getting alcohol in small bottles also. So that contains little bit of higher concentration of alcohol, so that we can wipe when we are opening the car doors, especially the car what do you call those handles. Those can be wiped with that type of alcohol. You have to clean the surfaces, especially that these door knobs, handles with hypochlorite solution. They must be strict. They have to follow the instructions of the doctors. Okay, general medications, what they have to take is vitamin C, vitamin D, and multivitamins and zinc. Why this vitamin C, vitamin D, and zinc are being given is because most of them, they have decreased immunity. So these act as antioxidants. They boost the immunity. So that is the reason why in India most of the patients have been given these medications. That is multivitamins and nutraceuticals. So for fever, we prescribe paracetamol, either 500 mg or 650 mg, and medications which are advised for the patients who have the symptoms. Either we go for azithromycin, amoxiclav, or that is augmentin, or doxycycline. These are little bit safe compared to other drugs. So azithromycin mostly we might have taken anytime in our life till now for a throat infection. So we don't have any of the side effects with azithromycin. But with hydroxychloroquine, when we are prescribing, so for every time when we are taking hydroxychloroquine, we have to take ECG. So every time to monitor the patient with ECG, it's difficult. And patients who are with comorbidities such as diabetes or cardiac patients or stroke, we don't prescribe them hydroxychloroquine. For them, we go for either azithromycin or doxycycline. And cetirizine, if they're having any running nose or cold, and if if the patient is experiencing loose stools, we go for Sporelac. And abdominal pain or to relieve acidity, we go for pantoprazole and famotidine. These are the medications. And antiviral medications, but as hydroxychloroquine is used only for malaria previously, but this hydroxychloroquine, what does it do is, it decreases the viral attachment, and it decreases it prevents the fusion of this virus in the body. So that is the reason why now hydroxychloroquine is used as antiviral medication in COVID condition. And what are the diet the patient can take? If we can take any diet, either vegetarian or non-vegetarian. Previously, there was a rumor, or there was most of this was circulated in the Facebook, that non-veg is one of the source of spreading. No, non-veg is not the source of spreading of this COVID. We give, in the quarantine, we give dry fruits, especially all the dry fruits which are available, and fruits to the patients. And we advise them to take lukewarm water, that is mild boiling water. And we advise them to take hot milk at least per day. And also we tell them to take egg. So if they experience any of these features, they have to contact either the doctor or any health facility. There is shortness of breath, breathlessness, if there is fever, chest pain, and any loss of conscious, or slurring of speech, or loss of sensation.
Vasu, I need to stop over here. Vasu,
Oh yeah.
I was asking Karthik the same thing, only that in the month of March, I have experienced a severe breathlessness, and that too exactly when Janata Bandh, which means it was in this year only, March 23rd, when lockdown was about to start. I happened to go to that high-tech city area, and I came home.
See,
Once
at
I
that time,
came, yeah,
one thing
what
I'll
happened?
tell you, Madhu. I'll
Mm.
tell you, Madhu. That time
Mm.
only I told you that high-tech city, that time constructions were there, lot of cement was there in the atmosphere. So that time
Achha.
most of them
So
had
there's not a symptom of
experienced.
COVID-19, right?
It was not the symptom of the COVID.
Okay,
Not
okay,
on,
go
not
ahead,
only you,
go ahead.
most
Yeah.
of the people who are working in IKEA and that
Mhm.
smart tech zone, and in and around Novartis,
Mhm.
little bit far residents of that area, they have called me. So that time I told them, because that time constructions were going on,
Mhm.
so there was much of cement dust and everything in that atmosphere. So people who were going on the flyover also had that time symptoms.
Mhm.
And these are the main thing which we have to practice. And recently these malls nowadays, I think from past 3 or 4 days, so now how the WHO has recommended these sanitizers and disinfectants. So we have to use, these are the sanitizers and these are the disinfectants. So the sanitizers, they have to contain this much of the concentration of these amounts. And if anything is there, if any doubts are there, you can ask any queries. I'm ready to clarify.
That's it. Any
Like
doubts, Ranjit?
yeah, पहले तो जरा चिंगारी लगाएंगे दोनों डॉक्टर के बीच में.
What?
After,
Yeah, tell me.
Okay, so you said, and with that I'll come to my question also.
Yeah,
after,
yeah.
can I see? Can I see you? I mean,
Yeah.
yeah.
चलो
बोलिए,
सामने से
बोलिए.
चिंगारी सामने से लगाएंगे सर.
अच्छा, अच्छा. बोलिए, बोलिए.
Okay. See, you mentioned about Karthik mentioned about hydroxychloroquine not being that effective.
Yeah.
And you mentioned that it is a good enough drug to take.
Means
What's your
hydroxychloroquine means we are giving to normal patients. Means
okay?
who are not having any comorbidities. For
Okay.
those patients only we are giving hydroxychloroquine. If they are younger, means less than 30 to 40 years of age, and if they are not having any comorbidities, for those patients we are giving hydroxychloroquine. If they are having any of the comorbidities, then we are going for doxycycline or augmentin or azithromycin. As
Okay.
azithromycin, most of us might have taken in our lifetime for any sore throat
Okay.
And in Indian scenario, because we are thickly populated, we don't practice any of this. Since the month of March, the Prime Minister was repeatedly saying regarding COVID. Even our senior, the present Chief Minister of Andhra Pradesh, he was the first person, first politician to comment on COVID. So whenever you experience any symptoms, you start taking paracetamol, do home quarantine, eat healthy food. None of them have what followed his orders. Everyone had made fun of him, and later on he was the person who was correct in advising the whole world.
Karthik, your take?
I think much more important than what you treat with, Aftab, honestly. I'm not trying to be diplomatic. I think all of us look for that magic bullet, right? Everyone
Right.
concentrates on treatment. Man, most of us, who even if we get it, will nowhere get to that treatment stage. Like 80-90% of us will have very mild illness or not even know about it, right? Like Vasu said.
Right.
I think everything else is much more important. What I would say is don't try to do too much, and be careful about how much is given to people who are doing well. Don't use it for contacts. I think that we are very clear, right? Regardless whether it's Vasu's or mine. If they're not positive, don't give it to contacts. That's where we're really going out of the uh, extreme, is giving it to everyone at home.
Hmm.
And then
For
you'll have a side effect and you'll end up in the hospital and get exposed to it, right? So that, I think, is no argument there. These are not prophylaxis. They just don't work. Even
when the patient is at home, means when their contacts are at home, we just give symptomatic treatment. We don't give any antivirals or antibiotics. When they are experiencing more, when they land up in moderate, that time we start this antibiotic. Till then, if they have mild symptoms also, when they have been isolated, for them also we are treating with symptomatic treatment and high nutritious diet.
Okay. So
um,
one more good thing in your presentation was biryani was definitely, it is not in the block list, so that is a big relief for all of us.
Actually, no. Strictly speaking, in isolation wards, most of them are having biryani only,
Okay.
because this biryani is made prepared but through those spices. Those spices have antioxidants more.
So I see you
If
want some
you,
biryani.
if you say there is no, if you say you can't eat biryani, the patient will die because they are so sad that they can't eat biryani. Forget corona. Lack of biryani will kill us.
Are Punarao? Where are you?
What is not
biryani for everyone.
Biryani for all.
My
Yes, my
Sudru,
question,
my
supplementary question. Is it all right to eat parcel food from outside, to have chai outside made at the bandi or something like that?
chai outside means we have to
Zoom
if they are
conference.
disposable glasses means we can, but if they are cleaning those with that water only. And I think in Indian scenario, those bandi people, they are most in rural areas, they don't use those disposable glasses. They use the glasses which made of glass. So those are the one of the source of transmitting. In Andhra Pradesh, one place was there in Andhra, that is Narsopet. A chai vendor, he transmitted to 100 people.
Oh my God.
He was COVID positive.
Another question.
Yes.
Not for the chaiwala, but there has been so 2-3 things have been suggested, like what from the WhatsApp University. Now they have one is of steam inhalation, like for as a general precautionary thing, especially maybe for people above 60, parents and stuff. So is it okay to go ahead with steam inhalation like on a daily basis? Does it work as a preventive?
Not on daily basis, but if they are having any discomfort,
Okay.
that is better. In the home, it is better.
At home.
So those two things, right? I think it's more important where you have
Mhm.
your food or chai more than how. If you love that one bandi, get it, heat it up at home and drink it. No issues. I think that's the more important concept, that where you're having it is more important. Don't have paradise biryani
In
in
paradise,
the restaurant. Have it at home. You're fine.
better to take the parcel and have it at home.
Yeah, that
Home
really is
delivery
the
is
bottom
better.
line. The steam part, be careful. If you do it 2-3 times a day, it does affect the lining, right?
Okay.
And makes it more susceptible to infection too. You're only thinking it's going to kill the virus, but our own mucous linings are not meant to get hot steam every day. If you're doing it
Okay.
sort of like how with a small nebulizer far away with a towel on
Yeah.
top or whatever,
Yeah.
then it's not a problem. But it doesn't help for prevention per se. That there's not the hypothesis. I agree with Vasu. It'll help you if you have it, and it helps breathe better. It helps people do something that you can do. My dad
Because
drinks
now in
the
India, rainy
Corona
season,
drink in the morning. I say, please, this Tulsi Haldi in there, please have. Why not? As long as it's not harmful, these are okay, right? These give you some chance of having control over it. Why not do it? And that's the same with these. With some of the antibiotics or antivirals, if they're not causing harm and it's very well watched, I think it's okay. Definitely not disproven therapy, but we would we have a tendency of fighting things off with a prescription. No one's going to ask how much debate happens whether I should wear eye protection and mask, but a lot more debate happens on what can I use to prevent it. Not the steam, but wearing this will help you. I'm not, in a way, I'm making fun of it, but also not really. That's a tougher one to do. If we can get one thing to take for 5 minutes, right? It's easier than something you have to do all day. All right, no more medical talk unless you guys really
Last,
want to
last
split
question,
things over
please.
WhatsApp.
Last question.
Nihal, yeah, Nihal.
What about these fog machines?
huh?
I went to Madhapur police station and these guys used fog machines.
Firstly, why were you in the police station?
Is that okay?
Lodging FIR for my client wanted me present.
Nihal, key professional side, just come to the point. Yeah. So he is saying that somewhat like police station. Okay.
Because
Hey,
those
they're using fog machines. So I wanted to know whether it's a good idea for me to buy a fog machine and use it at home.
no need for a home. But if you are in like like at the supermarket or in a shop, those people will use fog machines. At home, we don't use any fog machines.
Okay, okay.
A class Hawal. One last question.
Yes.
Okay. There is talk of, I mean, again, a little more chingari between both the brighter minds. There are talks of different strains of this virus going around. There's an Italian strain, there's an Indian strain, and something else going around. So, do you think that this mutation is like, how do you think it's going to mutate in future, or you think that it's going to taper off?
Actually, strictly speaking, in India there are many mutations. The strain had underwent many mutations, so that is the reason in India it is difficult for vaccination. In
Okay.
other countries, they had only one strain, so it is easy for them. In India, different states, different areas are having different strains. So the strains which are being discovered or seen in Rajasthan, they are not there in Karnataka. The strains which are there in Pune, they are not there in Mumbai. The strains which are there in Kolhapur, they are not there in Bijapur.
Okay. Okay.
So different clinical scenarios, different mutations are going on. Means it is undergoing many mutations. So that is the reason it is finding very difficult in India.
All right.
Now in India the vaccine trial also which is going on in NIMS, they have taken the strains in the month of March. Means the patients who have come from Russia and Germany. So in the first instance, when those patients who have landed in Hyderabad and Mumbai, on those strains they are doing the vaccine, but not on the present strains they're not, the biotech is not doing the vaccine trials.
So just one check. This is to both Vasu and Karthik. So, does a virus mutate so quickly? Because I thought generally, from at least whatever limited understanding I've seen on a lot of these news channels and all, generally it takes few generations for a virus to mutate. So is this very normal with a virus like this to mutate so quickly?
Shravan, it's different for different viruses. This one mutates actually very little. If say my whole family was infected, we would have the same strain. It probably takes a few generations for it to change a little bit, and that's where this is tough. It's I'm trying to say what's the simplest way to explain it. Its mutability is very low, and so far we don't know that the virulence is any different. There's some changes, and in general, viruses that have come over, right, emerging viruses tend to become less virulent over time. That's how it works for them. Why kill the people, right? Propagate, make more bache, keep propagating. So over time, it becomes less virulent, and that's how everything works. All viruses, all bacteria, in general, become less virulent over generations because they don't want to kill the host in general. With these different strains, almost all vaccines are looking at some areas that are conserved, right? You need those segments to propagate. If you don't have those segments, you can't propagate. So almost all are targeting those essential ones. If you don't have it, you die. So most vaccines are targeting those key sequences that are absolutely required for survival. Some changes for diagnostics might not target every single one. And therefore, sometimes some tests are not holding up as well for a mutated virus. Now people have learned better and are using more than one sequence in each test. In general, I would say these are overstated. I agree with Vasu that things change over a wide area, like a country that's as big as India. But the whole argument about strains is highly overstated at this point. It changes nothing. If some area is less affected, it's more so because of density reasons and, like Vasu said, mask wearing reasons and other factors more than the strains. Again, this is a whole magic bullet thing. We want a simple explanation. The one thing we know about this virus is there's no simple explanation. It is a complicated explanation. Why is Mumbai more affected, or some parts of Mumbai affected than more parts? Why are some parts in Telangana affected by more than others? A lot more to do with density, spread, use of masks, other policies more than strains. Strains will, I think we'll learn more and more that they have some effect, but not as much as is stated now. Again, it's one of those magic bullet ones. We want to think, and this was the one that was there early on in March, right? Oh, the Indian strain is much less virulent. Oh, Indians have a lot more immunity because of other things.
Stuff like that.
Yeah.
Want something to explain it, or the heat and humidity. It clearly is a lot more to do with the human factors of getting together, being together, laughing, sharing, being in an indoor environment than anything else that explains it. So if we say all this is fluff and just message to that 1 degree, right? That's the only thing that matters. Really, what am I going to do if I know the strain in Mumbai is maybe 2% less virulent than the strain in Delhi? Will I move to Delhi? No. There's nothing we can do with it. There's absolutely nothing we can control with it, other than for the scientists who are making vaccines and other things to be aware that all these strains are included in the vaccine. There's no other effect it has, nothing. If it wanes down, it takes a lot more generations for it to go away by itself. And this herd immunity will not occur just purely with infections or the strain suddenly becoming less virulent. It won't happen. The only way it will really happen is with the virus, with the vaccine. There's no other way we are getting to August 2021 with no infections without a vaccine. Our thing is to delay this however long, to have better medications, maybe a good effective antiviral that you get infected, you take it, almost like with flu. You can prevent the severe complications, great, right? And a good vaccine comes in very early. The last vaccine that came out quickly was 4 years. The last vaccine we've ever developed took 4 years to develop, the shortest time period it ever took. This one, the whole world is working on. This is more like 6 to 8 months. So I think that's where we are looking at. Um, there's no way this is just disappearing on its own.
Karthik and Vasu, to both of you. Karthik and Vasu, to both of you. Well, we are aware that in 1930s we had a flu, right?
Okay.
Right, and at that point of time we had no technology, we have got nothing like that, no social media, nothing as such. Then till at that point of time, I mean, how could the people cope up?
That time, what was the population? Now, what is the population?
Obviously it is less, I understand, but like medical wise there were no doctors at all. It was the Britishers who used to rule India. Like how did this virus flu and all off go off like that?
How was the build of the patient that time? How is the build of the patient this time?
I have
How
no
many
clue.
diseases were there that time? How many diseases are there now? How many
Oh,
comorbidities were there that time? How many comorbidities are there now? That time you would have not found any diabetic patient in 1 in 1,000. Now how many diabetic patients are there? How many obesity patients are there? How many patients have been on medications from younger means from starting of the age? So all this was the matter that time and now.
And a lot of these pandemics went in waves, killed a lot more people, and then died off. When you look at them, we don't have great accurate numbers, but they killed millions of people in places before they died down. So that's another way it can happen, and that's not. And because we are able to message it and control it in some way, it's not happening to that degree. And a little to do with this, it's not the same. Even with the SARS viruses, SARS-1, MERS, and SARS-2 are not the same. And that's where, again, a simplistic messaging that one virus pandemic is similar to the other, it's not. Some spread so quickly that when you spread so fast, then no one around you is susceptible to it, so it dies off. This spreads slower, despite what we're doing. It needs 15 minutes of exposure in close circumstances. Those ones require 2 minutes of exposure. Measles requires 30 seconds of exposure. So they spread quickly. Everyone gets it very, very quickly, and then it moves away. Because then the people surrounding you, even though you're infected, are all immune. So it dies off. It burns down, right? If it can't spread faster than you're getting it. So it's more a problem because it doesn't spread as easily. Different from what we've been told. It is actually tough to transmit it. It needs certain circumstances for it to transmit. And the host thing is very true, and crowding is very true with what Vasu says. All right, guys, send over any messages to WhatsApp. We'll be glad to. I don't want to kill off this joy by being so pessimistic on there. But honestly, the last thing I'll say is this is actually relatively easy to manage. Think of this, right? If everyone wore a mask, not even eye protection, if everyone wore mask at work, you don't need eye protection. If everyone wore mask for 2 weeks, everywhere in the world, it will be go away. So that's easier than any vaccine theoretically, but it's never going to happen. So the way we can keep ourselves safe and in our small environments, in our offices and work and other places, just make sure everyone else wears a mask and wears it well, not in the nose, not remove it to talk, eats away from everyone, not just separated by 6 feet, but really separates out, goes out and eats if it's possible in a covered area. It's very tough to transmit. I've taken care of 250 patients so far and probably interacted with 500 infected people. Not positive. I got tested multiple times, but not positive. It's hard to transmit it if you follow things. All right. No more bhashans.
Awesome,
Nihal,
awesome, guys.
anything
Great
else,
stuff.
Nihal?
Clothes, washing clothes, no problem, right?
Please wash clothes and use Rajesh Mohan's dry cleaning service. It is extremely good. If you fancy clothes, send them there. Yeah, I mean, used to go crazy about it. Now also, as soon as I come home, take off the clothes and put it in the washer. But my level of exposure is much higher than you guys. So I walk into the garage. First thing is strip off, put it in there, go have a shower and come in. But my degree of exposure in general is different from you. Maybe in a way, Nihal's exposure is like mine, because as unknown clients is in close circumstances, if they don't choose to wear a mask or whatever, right? Clothes are not as big a problem. The inanimate objects are not a problem. It really is more face to face.
These days, they are selling the UV boxes somehow. I mean, for the accessories that you get from outside, when you come from outside, you just put them in the box. The sanitizers, what they say. I don't know how effective that is or useful that is.
It is effective, but like Vasu's slide showed, this is an envelope virus. You shout at it loudly, it gets killed outside the body. You put anything on it, it gets killed. Almost anything. Dettol and stuff will kill it. Alcohol wipe will kill it. Anything will kill it. My cell phone, just put hand sanitizer on it. It's okay. Just make sure it doesn't go into the areas. Use anything you want. UV is much tougher to use in general and requires a period of time. You just pass it under it, it doesn't die.
Karthik, there's a message to you from Sandeep. He says that I think you can see a message, right?
Yeah. Sandeep is crazy too.
Yeah. Lysol, Crozex must be effective. What is that?
Yeah. Everything is effective outside the body. It gets killed really easily. One of the most easiest things to kill outside. It doesn't even survive a lot of sunlight for a while. Anything kills it.
Karthik, I'll ask you one last question and we can close this topic and move on to some fun stuff. So bottom line is wear a mask, be social, do social distancing and stuff. But do you think an N95 is needed, or a level 3, ASTM level 3 is enough, or, even a regular, plain old cloth mask is enough?
Good question.
Yeah. Depends on what you're doing. In general, right? If you are teaching a class, Pawan, and you're going to take it indoors,
yes,
and you can't reliably have your students wear the mask all the time, I would say an N95 is better, because you can't control what everyone else around you is doing. If you have a strict policy where a student removes the mask, you kick them out of the class, you're fine wearing a regular mask and eye protection. So it depends on where you are and how much control you have over people around you.
So eye protection, what do you mean by eye protection?
Like your work goggles or your face shield. So one of the best things you can do that's even better than wearing an isolated N95, which is tough to wear for hours and hours and you contaminate it with your hands, is to wear a regular mask with a face shield. That probably is just as good, if not in some ways better than an N95. Only if you're not in a very small room with people that you cannot control. So when I go see my patient, right, my most important thing is source control. If the patient refuses to wear the mask in my clinic, I'll say, I'm sorry, I'll give you a phone call or we'll do it over Zoom. I won't see you. So for me, it's more important that the other person is wearing a mask and I'm wearing a mask. If if 5 of us are in a room, right, all 5 of us wear reasonable face covering, then we don't need to anything else. By reasonable, I mean good cloth mask that's covering the nose, you're fine. If one of us is not wearing a face covering, right? It's just Ranjit is Ranjit and refuses to wear a mask, right? Then the 4 of us, then we are at risk because he could be asymptomatic and transmit. There, I would try to wear a face shield. And if I really can't control it, then maybe need an N95. I'm going to have repeated exposures with Ranjits who refuse to wear masks. Then maybe wear an N95. But if you, in those circumstances, the way to protect yourself would be to wear a face shield with a regular mask. Offers you significantly higher protection than anything else. When I go into smaller grocery stores like the Indian store here, I'll wear my face shield and mask. Because I don't know the one in front of me who's shopping, he starts scratching and removes his mask and then coughs. I don't know. So I try to wear there, know exactly what I need, step out in 5 minutes, but wear eye protection with a regular mask. So I know it's a depends question. Go ahead.
So sorry to interrupt, but what I was going to ask was, I can't really wear an N95 mask and teach because I mean, obviously the voice is muffled and stuff in a classroom. So I found a level 3 surgical mask, which works well for me to speak in front of a class. So is that still okay, or level 3?
Yeah,
it doesn't matter.
wear a level 3 with goggles, and if anyone removes their mask out, kick them out.
I will be Punarao, man. What you're talking about?
Yes.
I will be Punarao. I will not kick them out.
Absolutely.
I will slap them out.
Absolutely. So that really is what it is, Pawan. It is about making sure people around you wear it. So if you work in a cubicle in a smaller office and 6 other people in cubicles, it's important that everyone wear it. That's the tough part, right? And you ventilate as much as you can. You're going to have a tough time doing that in Wisconsin. Do as much ventilation as possible. And if you're staying reasonably far, it helps. But that's the whole thing. If you're having a class that's indoors, it doesn't help you that you're just 6 feet away from him, so you're okay. The teacher is 6 feet away and you're fine, completely fine. No. There, I would say use eye protection and a reasonably good mask. Then your risk is low. And do your best to make sure people there put on their mask, however long you are.
Yep.
Hey, Pandu, you should send us one of the recorded sessions, man. I actually really definitely want to see you teaching.
I second that. Me too. I want to watch you teach.
Maybe we should figure out the Zoom and